I have patients come to me frequently and they have high blood pressure, and we call that hypertension. There have been recent studies that show a direct link between blood pressure and length of life. We're trying to encourage people to get that blood pressure as low as possible without getting so low that you're passing out, but low enough so that it's taking some of that burden off of your heart. Increased blood pressure has increased rates of strokes and heart attacks. People usually don't feel bad when they have high blood pressure. They might have headaches, they might not. It might just be picked up in your routine annual exam. Over time, this is causing damage to your heart and your vascular system. And so it's important to keep control of blood pressure. Obviously, medicines always have risks and benefits. And so if we can keep you off of a medicine, that's better than having to put you on a medicine. For most people, a blood pressure of 120/70 is the goal or considered normal. We don't usually start medicine until people's blood pressures are more like 140/90. I try to get people to first do some lifestyle changes because there's a lot of things that we can do. Losing weight can definitely help with your blood pressure. They've also done studies that show if you exercise like 45 minutes a day, it doesn't have to be, hardcore cardio. It can just be walking. And that little bit of activity, even if you don't lose any weight, will also help bring down your blood pressure. The biggest thing we talk about all the time is reducing salt. And all the food that we eat that's prepared food, it comes from restaurants or prepackaged food, is just full of salt. So going on a low salt diet and a no salt, like no added salt, can also really give us a big benefit. Having more potassium in the diet also helps bring down your blood pressure. So a diet that is more based on plants, and actually for overall health, if we all ate 10 to 12 servings of fruits and vegetables a day. But ultimately, the goal is to get the blood pressure under control.